Hey, so today I'm actually going to leave the house and I'm going to the Gaudiani Clinic for lunch. Now, you may have heard some podcasts that I've done with Dr. Jennifer Gaudiani, who is an internist who specialises in treating people with eating disorders. She only treats people with eating disorders. How incredible is that? So that's why I have her on the podcast so often, because she knows all the medical stuff inside and out in fantastic detail. So she's wonderful to have on the podcasts. But I love the Gaudiani Clinic, which is where Dr. Gaudiani practices, funnily enough, because, well, first of all, I just like it because they've got a great crew of people who are really fun to hang out with, and I do literally just go and hang out with them and have lunch sometimes. That's how fun they are. And I never thought I'd say that about a doctor's office. They really are a fantastic team of ladies who just are great fun. But the other reason that I love the Gaudiani Clinic is because this is a place where people, adults who have eating disorders and may have had an eating disorder for a long time and may have physical complications or just things that you're worried about, the things that go on with your body when you're in recovery or sometimes even when you're not yet in recovery. All of that stuff can be concerning and bewildering. And to have a doctor that just specializes in those things and knows about those things, and also someone like Dr. Gaudiani, who is not afraid to help other people and try and educate other doctors as well. That's a really fantastic resource. So yeah, I'm going to take you on a little journey with me. We're going to have a look around the Gaudiani Clinic, and I think it can show you how different a doctor's office can actually be than probably what you might be used to. Before we go anywhere, let's take a moment to appreciate just how cute Stinky is this morning. Purring away like a little gorgeous thing, aren't you, Bob? And here we are. Okay, so first things first, let's get Dr. Gaudiani to explain the Gaudiani Clinic and why she established it. Here's Dr. Gaudiani.
Hi, I'm Dr. Jennifer Gaudiani. Tabitha was kind enough to come here, have lunch with me and my team today, and ask me about why I started this clinic. I've been in the field for about a decade now, and I had the joy of working at the Acute Center for Eating Disorders at Denver Health for 8 years. And then I realized I need to start an outpatient clinic. I want to take care of people from all across the country, all ages, all genders, all shapes and sizes, to be able to take care of their eating disorder needs in an outpatient internal medicine setting. So I thought, I want to hear the whole story. I can't just fall in love with my patients for 2 weeks in the hospital and then have them go on to programs and not know what happens to them. I want to really follow the whole story, the ups and downs, while they're in the context of their outpatient lives, the lives they're going to return to when all of the other treatment is done. I love the idea of working as part of a multidisciplinary team, not as the head hierarchy, but just as a part of a team, usually with a therapist and a dietitian, sometimes a coach, to try to help somebody recover on terms they set in a non-assumptive way, heading towards their goals and values. It's been a joy to start this clinic. I learn new things every day, and I'm glad to be able to share it with you. Hi, so this is our exam room, and one of the things I love about this practice is that I get to be a fully functional primary care doctor, or GP, for people with eating disorders. So it's flu shots and it's pap smears. I really try to make the time in a gown on a table as minimal as possible, because I don't like the power dynamic of I'm in my clothes and you're there in a horrible gown. So we try to minimize this and move on to have a nice long conversation. In our procedure room, patients get their blood drawn as well as have the opportunity to receive IV fluids, because nothing is worse maybe than going to the emergency department when you have an eating disorder and having the whole experience of getting IV fluids. Instead, my patients can curl up here with a blanket, with schoolwork or work, or just take a nap and get slow IV fluids in a safe setting.
Now I have to introduce you to Meghan and Aimee. Meghan is the Chief Marketing Officer and Outreach, and Aimee is the Chief Operating Officer. And they are fabulous, very friendly, great sense of humor. Just, I adore them, they're great. And I think that just having people present in the doctor's office that are friendly and people, they are people, it really makes you feel relaxed, which adds to the whole experience of this not being a sort of horrible place where people prod and probe you. Anyway, here are Meghan and Aimee.
Hello.
And she's with Bodhi.
Bodhi, the GC mascot dog. Hi, I'm Meghan Iliopoulos, and I'm the Director of Marketing and Outreach here at the Gaudiani Clinic. And this is...
I'm Aimee Becker, and I'm the Chief Operating Officer here at the clinic.
If you are interested in learning more about the Gaudiani Clinic or interested in starting the intake process, you can give us a call and you'll speak with either Aimee or myself.
Tell me about this lobby then.
So we love to make our patients feel really welcome when they come in. And one of the things we gave a lot of thought to was to have furniture and space that patients in every size body would feel really welcome in.
Mm-hmm. So no tiny little chairs?
No, that's exactly right. Yep, we wanted everyone to feel welcome.
Gotta admit, it doesn't look like a doctor's office.
We wanted it to feel soft and welcoming, relaxing.
Relaxing for when you're already a little bit stressed about going to the doctor.
Yeah.
And you get here and you're not so stressed.
Yeah, most of our patients haven't had a great experience with doctors in the past.
No.
So we've got a lot of undoing to do. And I'm aware of the position that I have as a physician and how that may have been harming the profession for patients before.
Yeah. So making people feel as at home as possible and like they're with a load of friends.
Yeah,
which is why I like having me out here.
Yeah, we love having.
So I know that a lot of people are quite traumatized by going to the doctors. If you've had an eating disorder for any length of time, being weighed for one thing, a lot of people just go to the doctor and be weighed, so sort of have that association with it and just feeling threatened. And for me, going to the doctor, I just used to refuse for a long time. I didn't go to the doctor at all because I just felt like I was poked and prodded, and I just felt actually a lot of time didn't help. The message was always that restriction was good and the over-exercising that I was doing was also good, and that I know I didn't really need to hear that. I don't think I found going to my GP particularly helpful when I had an eating disorder, and that just gave me this association more than anything that it was just a waste of time. I think that was my problem. A lot of people have much worse associations than that, like are actually sort of traumatized by the process. So I think that for many of us, as we go through recovery, we have to find a different relationship with our doctor's office. And I'm happy to say that I have a doctor here in Boulder, and she's just retired, god damn it. But she's been great. Just a really personable, caring person that I didn't mind going to see. And I think that that's important. You have to feel that your doctor understands you and is going to help you because they understand you. One thing I think is true about being human is that when we can't understand one another, we're not very helpful to one another. And I really hope that more and more places like the Gaudiani Clinic open up, or that they just grow and expand and we get one everywhere. That would be nice, wouldn't it? And I really liked the way that the place was so relaxing, because, well, I'm the type of person... Stinky just bit my hair. Stinky. He's licking me, that's really cute. I love you. Anyway, I'm the type of person that when somebody tries to take blood from me, my blood vessels like close up because I get stressed about it and I hate it. I think that having that sort of thing in that nice, relaxing environment where it doesn't look all kind of clinical and scary and sterile and horrible, I think that even my blood vessels would open up sitting in there. I mean, the Gaudiani Clinic's so nice that I just go there and I'm not even a patient. They have puppies in the office. There was a puppy in the doctor's office. All doctors should do that. Okay, well, I don't think the puppy didn't live there. It was just kind of lucky that the puppy was there when I was there. But I still like that. I think that they should get one. I think there should always be a puppy in doctors' offices.